In gram-negative bacilli, the first bacteria we are going to talk are Salmonella. So, Salmonella, we have known that Salmonella is gram-negative, lactose negative, then oxidase negative. So there is a triple negativity, and also it's a gas producer. Non-gas producer are Yersinia and Shigella. So how Shigella, I'll make a story for this. So how this uh, pathogen infect human body. Salmonella has actually a high infectious dose. Infectious dose 50 means that the the dose or the number of bacteria which can cause infection in 50% of the population is known as infectious dose. And if the infectious dose is high, it means that in order to cause infection, there must be a large number of bacteria, a large number of exposure, and a large number of bacteria exposure is required to cause disease in the patient. So Salmonella has high infectious dose, but high infectious dose, it means large number of bacteria is required. Large number is required in immunocompetent patient. Immunocompetent. But if the patient is old, having a debilitating illness, or immunocompromised, or he is suffering from immunocompromised, also he is on peptic ulcer diseases, then the infectious dose is very low. It means that only small number of bacteria can cause infection in the patient. So this bacteria is actually, Salmonella is actually acid labile, that in immunocompetent patient we ingest that bacteria and it is destroyed by the gastric acid. But if a patient is old, having debilitating illness, or especially on the PPIs, or if the patient has any kind of gastrectomy, or there is achlorhydria, then the bacteria passes the stomach, goes to the intestine, and in the intestine it invades microfold cells of the Peyer's patches. Over there, Salmonella has in the microscopic in the microfolds of the Peyer's patches, macrophage engulf this bacteria, or trying to phagocytose engulf. But our bacteria has a type 4V capsular polysaccharide which evade immune defense, from the macrophages. So this type VI capsular polysaccharide is help the bacteria to evade phagosome, and it after evasion it replicates in the macrophages. So in replication in the macrophages, it replicates in macrophage and also causing monocyte predominance on the infiltrate. So when we, for example, we do some biopsy, so we will find primarily monocyte infiltration in the biopsy. So now in the bacteria, it robust, or it attract a lot of macrophages and a lot of defense phagocytic cells to come and increase the body immune response. But our body defense is very much overwhelmed regarding this bacteria, because we are very much helpless. We cannot destroy this bacteria, so we call a lot of phagocytic cell in order to kill this bacteria. But this bacteria is now very much proliferated in the macrophages, and now it can cause high fever, and generally high fever is actually cytokine mediated, and it is also causes the bradycardia. But in this salmonella we have bradycardia, or decrease in the blood pressure, which is known as the fever, which is known as the pulse temperature dissociation. This is important clue regarding the salmonella infection. This pulse temperature dissociation leads to, so in the first 1 or 2 days, the person is suffering from high fever, bradycardia, and after some time, the patient is now suffer from severe constipation, and also followed by simply diarrhea. So this diarrhea is now the patient is suffering from high fever and diarrhea. Patient gives you the history that he's a traveler. He goes from any endemic area like Mexico, and in there is a poor sanitation system. So he just drink some water which is not very much filtered, so waterborne transmission. So he does not filter that water and use that water, and this water has a lot of the person is also on the PPIs. That water can lead to all the sequence of this sequence of the course of the infection. So now he is suffering from high fever, bradycardia, constipation, and diarrhea. And as we know that the human are the reservoir. It means that a human can cause infection to it. If a human fecal matter is goes into the water supply of the patient, then there must be a lot of patients which are exposed to that bacteria, and there is a disease or there is outbreak of salmonella infection. So now after causing diarrhea and constipation, the salmonella is hematogenously spread from macrophages to the reticuloendothelial system. It goes to the skin and causing the rose spot. Now this bacteremia cause rose spot on trunk. There is a blanchable type of rose spots on the trunk. So this is also a very much a presentation of the patient suffering from salmonella. Also, at this moment, if we treat the patient with ceftriaxone or quinolones, then the patient is saved from this disease. These antibiotics prevent the complication which are such as there is GIT ulceration, and there is a hemorrhage, GIT ulceration, GIT hemorrhage, and also there is a complication is GIT ulcer, GIT hemorrhage, which leads to bloody diarrhea, and also there is a gallbladder problem because the bacteria, gallbladder abnormality, because the bacteria colonize in the gallbladder. So there is a gallbladder problem, there is an ulcer problem, there is a hemorrhage problem, there is also a rheumatoid arthritis problem, that the person is also there is also a reactive arthritis, sorry, there is a reactive arthritis problem, that the person is suffering from diarrheal infection, and now he is presenting with the painful joints and reactive arthritic condition, and this is a type 3 hypersensitivity reaction, which is the immune complex mediated reactive arthritis. So at this happen in a general course, but if a patient, if the traveler is having a oral live vaccine for the typhi, or also he is intramuscular killed inactivated vaccine, then he is also pretty much safe from these complications. So vaccine is available, antibiotics are available, so we can treat this patient with this salmonella infection. So this is all about the infection of the salmonella. Salmonella is hydrogen producing and hydrogen sulfide producing. It is also human reservoir. There is also a flagella, motile. So this is all about the salmonella infection. There is also a species of the salmonella species. We have discussed the typhi bacteria. There is other than the non-typhi salmonella, which are non-typhi strains, and these are very much foodborne problems. Like foodborne, this strain is very same like Salmonella typhi, but this non-typhi strain is primarily foodborne. Like we eat poultry, undercooked poultry, or undercooked eggs or infected eggs. Also reptiles like turtle, and they are infected and they can cause gastroenteritis or watery gastroenteritis or watery diarrhea, which is most common in US because because of the typhi vaccination, and foodborne, and this is self-limiting. And also in the minority of the cases, like those minorities which are old, which are immunocompromised, or any other debilitating illnesses, this salmonella non-typhi is converted into can cause especially the minority which have sickle cell disease, it can cause osteomyelitis, it can cause mycotic aneurysm, it can cause it also causes endocarditis and rheumatoid reactive arthritis. So this is all about the salmonella. And next we have left the Proteus. We have known like salmonella, in the Proteus family it is gram negative, lactose negative, oxidase negative, but it is hydrogen sulfide gas producer. It is also urease producer, which leads to straw white kidney stones, and also it can cause urinary tract infections, especially acute cystitis, and these stones lead to chronic pyelonephritis. And this Proteus is very much catheter induced, indwelling catheter induced. Catheterization can cause Proteus, and also it is one of the causes of reactive arthritis. The most unique feature of this, which is given in the question stem, is the swarming as it is motile. So there is a swarming motile growth on agar, and This is the important clue, that urease positivity and this positivity, it can tell you, it can clue you that the question that the examiner is asking about the Proteus bacteria. So this is all about the hydrogen producing gram negative, lactose negative, oxidase negative bacilli.